morning, and welcome to our first program of Technology Association of Oregon's Health Tech Summit. We're excited to kick off with a conversation focused on policy innovation and healthcare data. I'm Skip Newberry, President and CEO of TAO, and I'm joined by Riley O'Brien, VP of Events and Experiences, who's providing back-end Zoom support. A couple of logistical items before we start. All participants have been muted. Please remain on mute unless a TAO staff member unmutes you and calls on you to talk. You may ask or respond to questions in the chat box publicly or privately by directing your message to me or Riley, who is under the name Special Events. We'll monitor the chat box and respond throughout the discussion. We'll ask you all to engage via the participant icon on your screen. We also want you to engage with us on social media during today's presentation and throughout the day. We love to share what's happening at TAO and to get participant takeaways from our events. Please join us today at 10:30 a.m. for our next conversation about the advantages and disadvantages of expanding mental health treatment and research and technology. A big thank you to OTRADI and OBI and the Israel Consulate General to the Pacific Northwest for helping to underwrite our 2 days of programming for the Health Tech Summit. We appreciate their support and are excited to explore topics related to digital health. And finally, it's my pleasure to introduce our moderator for this conversation, Industry Group Leader for Healthcare and Life Sciences with Schwabe, Williamson, and Wyatt, Ann Talcott. Ann?
Thank you so much, Skip, and good morning, everyone. It's really an honor to be here today with these panelists talking about data privacy in the healthcare sector. After almost 2 years of the pandemic, with forced work from home and shifts by many healthcare practitioners to telemedicine, combined with the daily data breaches across industries, including hospitals and other healthcare-related businesses, there's no better time than now to discuss innovation and the policies affecting healthcare data. Before we jump into the program, though, I'm going to ask that each of our panelists introduce themselves, starting with Pam Dixon.
Yes, good morning. Thank you to TAO. I really appreciate the invitation to be here today. I'm Pam Dixon, the founder and executive director of the World Privacy Forum. I am based in Portland, Oregon, and just very pleased to be here. Thank you.
Christina.
Hi, everyone. My name is Christina Glabus. I'm the owner and founder of Gazelle Consulting, and we provide HIPAA compliance and GDPR compliance and CCPA compliance consulting to a variety of different businesses. I'm really excited to talk with you today. I'll be replacing Kimberly McCullough from the DOJ. She wasn't able to attend because she has to do a testimony today. But I'm really looking forward to talking with you all about some of the policy direction that we're expecting to see or hoping to see in the future related to healthcare data. In particular, we do a lot of work with variety, different companies, whether they're software companies or behavioral healthcare companies or clinics. So there's a broad perspective that we've seen of compliance need across the industry, and happy to be here as well.
Thank you, Christina. Lauren Wallace.
Hi, good morning. It's great to be here today. Thanks so much, TAO, for the invitation, and I'm just so honored to be on a panel with these amazing privacy pros. I'm the General Counsel and Chief Privacy Officer at Radar First. We're a Portland-based company in the privacy tech space. We provide solutions to help companies manage their data breach notification obligations across more than 300 jurisdictions, and have a lot of experience working with companies in the healthcare space and financial services space, where there's a lot of sensitive data being managed, sometimes in incredible volume. So this is a really important topic for us and for our customers, and very happy to be here to talk about it today.
Thank you, Lauren. Thank you all. So let's start off with a description of the regulatory framework. And Pam, HIPAA is likely the most well-known legal framework regulating healthcare-related data. But what other sectoral and comprehensive laws and regulations cover healthcare-related data?
Well, thank you so much. I appreciate the question. So I'm going to, I think I'm going to start locally and then work my way up to a little more broadly. And I'll just kind of glance on things and touch on them and just give you a bird's eye perspective. So today, I mean, this is a different talk today than we would have been able to give 3 years ago. And there are a lot of reasons for that. And let's start talking about that right now. So the first thing that we're dealing with right now is that HIPAA data is one thing. HIPAA data is regulated at the federal level in the United States. HIPAA creates a floor of regulation which states can then build on. So Oregon and many other states have indeed created additional laws on top of HIPAA. So for example, there are a handful of states that have created extra genetic regulations or extra regulations about medical data breach and so on. But public health data, which is the health data that we've all been so worrying with during the pandemic, public health data is regulated at the state level. So this creates an entirely different framework. And to say that there is a profound confusion between HIPAA and public health data is an understatement of quite significant proportions. I'm going to add in an additional framework, which is the Family Educational Rights and Privacy Act, or FERPA. FERPA also regulates health data at the federal level. It regulates it in any educational institution which accepts federal funds. There's quite a lot of analysis that states that FERPA actually provides better protections than HIPAA does, but FERPA does not cover health data. In most federal systems, public health data is exempted. And then moving to the CDC, the Centers for Disease Control, which of course is under the Department of Health and Human Services in the US. They are a public health authority, and they do have a lot of leeway and regulatory ability to create a lot of emergency data flows and rules, and to collect state level health data. So during the pandemic, ever since approximately March of 2020, the United States has had HIPAA waivers in effect in order to ease the data flows in the pandemic and to provide the ability for a lot of different entities to work with data and utilize data. I think the most notable HIPAA waiver that's going to be of interest to this audience is the telecommunications or the teleconferencing HIPAA waiver, which allowed a very broad, rapid adoption of teleconferencing rules during the pandemic. It's only a temporary rule, so there's definitely a discussion to be had about innovation there. And I'm just going to conclude with a very quick touch on the GDPR, the General Data Protection Regulation in Europe. I think that I'm just going to say, I mean, we've done a huge analysis of this, and what I have to say to you is that GDPR is completely inapplicable in many important ways to the pandemic because there's something called a derogation. It's just like the HIPAA waiver. The rules are suspended for national health emergencies. So the frameworks have, because of the emergency nature of a global pandemic, have largely been lifted. And then the final thing I will say is that because a lot of rules have been lifted, there's been an increase in the use of public sector data to help sort out the pandemic. And this data is going to both the CDC and the World Health Organization. So we actually, in the past 2 years, have built an entirely new health data ecosystem. So there you go. That's the initial layout. Thank you.
Great, thanks, Pam. But with all of the parts of that framework, there's still gaps in the system. Christina, can you talk a bit about what those gaps are?
It's like I'm muted. Can you all hear me? Great. Yeah. So some of the gaps between kind of federal legislation and state legislation might be related to the different types of things that can be regulated at the federal and state level. So anything that governs interstate commerce can be governed at the federal level, which can be very inclusive of a lot of health data. But there are limitations to that. So that's why you see things like adoption being regulated at the state level. So when we're talking about health data, that's probably going to be something that could be regulated at the federal level. but states are able to move more quickly. So you saw in Oregon, we worked with Pam and the DOJ and the Consumer Privacy Task Force to develop contact tracing regulation that created controls for things like location data and who you interacted with. And that is a very focused state law that we were able to pass. But you see when states are moving quickly towards initiatives that don't have a clear objective in the future, that might be something that can either fail at the state level or fail at the federal level. Ideally, it's federally, we want to have the most comprehensive privacy policies possible, something like GDPR or CCPA, but it's going to be the states that are going to have an opportunity to maybe do something a little bit more experimental. But we want to think about what are we comfortable with our laws experimenting about? So when we're going for state laws or filling in some of those gaps that might result from incidents that we didn't predict, health events that are affecting large populations, we want to pursue legislation at the state level that we know is going to be successful. So things that are limited in scope, that we have broad, bipartisan support and coalition support for. And that's really where we would want to see the roles of state laws come in before we move towards comprehensive federal legislation.
Great, thank you, Christina. Lauren, from the industry perspective, how do you recommend that businesses make decisions within this regulatory framework where there are some areas that are filled and then there are these gaps?
Well, you described it as regulatory framework. We might better describe it as a regulatory patchwork. Obviously, it is very, very challenging for businesses. And I think both Pam and Christina touched on the overlap among all these different health data rules, but overlaying all of those is that often health data is also consumer data. They're intermixed, and not every entity that manages consumer data will necessarily analyze it as health data. But in particular, we have a lot of companies coming out in the app space, for example, that are gathering very large quantities of health information from individuals, which would not be covered under HIPAA because those app companies, for example, are not covered entities in the way that HIPAA defines covered entities. So I think what companies need to do is, first of all, stop and think, step back. Look at privacy principles in general. And I think all these frameworks that we're talking about adopt in slightly different ways a pretty meaningful set of privacy principles that can be applied to all your data sets, whether it's healthcare data or consumer data or financial data. So take a step back and think about, well, what are we really doing here? Just because we can gather this information, just because we can make a tool that can seamlessly collect it from consumers doesn't necessarily mean that we should. And once we have decided from that perspective, what is the meaningful data that we really want to collect, then you can take a more sectoral view and say, okay, what are the rules that cover the data that we're actually going to collect? And what are our obligations for retention and maintenance of that data? And in particular, what are our obligations to notify if that data does get impacted by security incident of some kind? So always, I would say the first thing is to stop and think. Just because you can gather the data doesn't mean that you should. And if you decide that you do want to, be very mindful of what your obligations are around maintenance and retention of that data.
Thank you. Let's shift and talk about ensuring that sensitive healthcare data is managed in a universally transparent, inclusive, and equitable way. Pam, what are your thoughts on how that can best be achieved?
Yes, that is a really great question. Thank you. So I'm going to start with more of a universal way, and then let's get to health equity because that's a really important issue. So one of the really key trends that we're seeing globally in regards to especially the data that is existing for the most part outside of regulation, because the regulations have been suspended largely across the world, is that of using very robust de-identification or pseudonymization for data that is even halfway sensitive. So for example, if you look at the various data sets that are coming out in regards to COVID, one of the very, very robust data sets that's being utilized around the world is that from our mobile devices. So for example, Apple has released deeply aggregated data sets at the state level for how people are moving, and there's data at the country level, and it's absolutely fascinating. So for example, there's data for Cambodia and how the movement of mobile phones and people changed during the pandemic, and you can compare that with, for example, France or other countries. It's really extraordinary. This is data that would not have normally been considered to be used, but the emerging trend is to deeply de-identify and pseudonymize this data so it cannot be put back together or re-identified. So I do think that this is an area and an opportunity for really good innovation, particularly when there is a lack of what I would call bold, black line, glossy regulation that is very directive. So I think that's super important. I think the other thing that I would say is in regards to a variety of equity issues. This is really coming to fore with actually a different ecosystem, which is identity ecosystems. Around the world, and even in the United States, there are a lot of questions about, okay, when do we ask someone for identity to prove their vaccination status or et cetera in any context? And this question is being hashed out in real time. I think that we have an opportunity here to de-link direct identity. In other words, is someone asking to scan your driver's license in order for you to enter a restaurant? That is not a best practice. I do think we have some basic best practices there. And I think that this will help with equity and inclusion, because even today, not everyone has an ID, and not everyone who has an ID wants to show their ID and to be directly linked to their vaccination status and give their home address or phone number, et cetera, or even name to people where they might prefer to be anonymous. And I do think that this is a way we can really help with inclusion. The other way we can help with inclusion is to ensure that we're using best practices in data collection. So for example, if we are only collecting data from certain communities and not all communities, then we've got a problem. If we're only looking at wealthy neighborhoods, not all neighborhoods, we've got a problem. That's just the start. I think it's a complex issue, but I think that starting with looking at our data patterns, our collection patterns, and ensuring that everyone is being treated equally, that's a very important start. Thank you.
Thank you, Pam. Lauren or Christina, do either of you have anything to add?
Well,
Yeah. Oh, go ahead, Lauren.
oh, sure. I just want to get behind Pam's comments about data collection and analysis before the fact rather than after the fact of what is the point of this data that we're collecting and what are we going to do with it, instead of just because we have the opportunity to go out and collect this data, we're going to.
Yeah. And to elaborate on that as well, what we are trying to help our customers do in compliance initiatives is to broaden their perspective on who is considered a stakeholder. So there's the obvious stakeholders like the CEO, the client, the users, but we also want to think about, who, like Pam was mentioning, who was in the data set that was used to train the AI, who was excluded from the data set that was used to train the AI, and why, who is this product attempting to serve, and who is this product not trying to serve, and why. We also want to consider the society at large, the lawmakers who have taken time to regulate the data. Those are stakeholders in how you use that information as well. Who is impacted by the work that your company does. Those are stakeholders as well. So that gets into kind of thinking about what some of the positive or negative externalities of your business are, and not just focusing on what you can see directly, but trying to uncover more about what your role is in society and how you can positively or negatively influence that. The other things that I think about in terms of equity are making sure that we look at what the laws are, look at how HIPAA is being regulated presently compared to the past. So historically, there's been a lot of regulation related to security issues, things like making violations resulting from lack of training, lack of a risk assessment, lack of policies and procedures. But in 2020 and 2020 for sure, all of the violations were related to rights of access. So we're also seeing that the HIPAA laws are being revised. Those revisions are not finalized yet, but a lot of the revisions had to do with right of access and making the data more available, making it more easy to share, preventing information blocking between parties that have a need to view that data. So from the software perspective, what I would recommend is consider planning for technical requirements to make the data readily available if that's not already a part of your system. One of the controls that we may see coming up from HIPAA in the future is to make that data available on the system which the users access their product on. So things like MyChart and Providence might need to be more commonplace. So if that's something that you don't already have, I would look into that. And then making sure that we have a transparent supply chain. Things in the HIPAA world, you've got covered entities, you've got business associates, and you've got their business associates, and that's where things break down. Anything after that doesn't really get addressed in a lot of circumstances. So I'd like to see more legislation that will address supply chain transparency so that individuals have an actual option to consent to the reality of how their data is being used, not just the obvious ways that their data is being used.
Could I follow on Christina's comment?
Of course.
Yeah, so I really agree with that. I think it's really very much on target. And, Christina's talking about the it's thousands of pages of the quote unquote interoperability rule. It's a very complex regulation. But one of the things it does on the consumer side or on the patient side is that there's no requirements yet to actually provide notice that when a patient chooses to share their data outside of the HIPAA environment, that the regulations, the regulatory privacy protections lift from that data and it becomes in the wild and unprotected by federal privacy, HIPAA regulation. So we would love to see more notification about that to consumers and certainly more education for consumers and patients. I think that would really help. But I think something else that really dovetails with what Christina was saying is to really engage in a process of continual improvement, because there is no way no one can get this right on the first go. We will need to be very, very self-aware and really engage with stakeholders and really monitor and audit ourselves and get feedback and really make sure that we're reaching out and truly, finding the errors and, improving them. Sometimes, especially in the world of privacy and data, there's a bit of an animosity. Oh, if you make a data mistake, it's kind of a gotcha. I think that it would be much more instructive to move away from that stance and to really focus on making very rapid improvements in your data cycle and continuing to reach out to stakeholders and gather input, because stakeholders can tell us where there's a lack of equity, and that's super important for us to hear. Thanks.
Following up on that, Pam, what do you think would be the best approaches to policy development to build trust and avoid silos between the essential stakeholders in this dynamic data ecosystem?
Well, I think we have to look at the issues as they come up. So right now, we are definitely in the midst of what I would call a vaccine credentialing system issue. We all know that vaccine credentialing systems or proof of vaccination system or proof of testing system are rolling out everywhere, including possibly, depending on the courts, to many, many employers, about 2/3 of employers in the United States. And we need to understand, okay, so how do these systems look? What are the transparency features? What can be improved? I think we'll have to deal with each crisis as we go along. And I think the crisis right in front of us is to find ways to create trust in these vaccine credentialing systems, because they are not liked by people. And there are so many questions. And people are quite literally, I mean, they've reached out to us, a lot of folks, and they're saying, look, we just don't want to, go into this system and share our health data with a restaurant or a retailer or a business not known to us. What are they doing with it on the back end? And I think that businesses could do an extraordinary amount to increase transparency and say, hey, we are only checking yes or no here, whether or not, you can enter the restaurant. We're not keeping your data, and to really think through some of those policies. Thanks.
Great, thank you. Christina, are there any other elements of data privacy we need to think about when we're creating policy?
Yes, and I wanted to answer a little bit about the policy, building trust in policy development too, if that's okay. Or should we move on from that?
No, of course.
Okay, yeah, because I just wanted to share a little bit about the work that we did with the AG Privacy Task Force. The DOJ had noticed that over the years there had been different disjointed efforts to create a privacy policy that hadn't been successful because there were people trying to push things past the objections of different stakeholders with different points of view. So what the DOJ did was they created this consumer privacy task force that had representation from technology, consumer advocacy, small business advocacy, big business advocacy, legislators, and created a central table of a more diverse group of those individuals so that there could be some equity in terms of who is at the table, making sure that the folks from the advocacy group had a chance to speak, because there's about 70 or 80 groups that are being represented in that task force. And they found that a lot of the time the tech companies were speaking with a louder voice than the advocacy groups. So the central table kind of distributes some of the ability to speak. It's a lot more formally moderated by the folks at the DOJ, and has really given us a more diverse perspective on what we need to think about and who the stakeholders are. But that still doesn't solve some of the problems with equity, because there are still groups that didn't make it to that table either, because when you're talking about groups that are struggling, they do need resources in order to participate. And so how do we get the funding to the individuals or to the organizations that can actually collect those stories that we're too far removed from to hear? So our company, when we get calls from our website, we have a thing on our website that says, call if you have any questions about HIPAA. We get a lot of calls from individuals whose rights have been violated, and they're looking for some recourse, they're looking for some support. And I'll tell you that it's mostly people that are non-white that are calling with those kind of issues. But when I poll people to ask them, do you have any stories about, individuals or yourself that, about how data has been abused, there are certain segments of the population that don't have any awareness of how this goes down, and there's certain populations that are very aware of how this occurs. So it's certainly folks that are Black and brown that are being targeted by data abuse more readily, and that's something we need to consider in terms of funding. How are we going to make it possible for them to join us at this conversation? There are certainly advocacy groups that are doing work like this, like Coalition Communities of Color as doing advocacy. We also see, in terms of the war on drugs, and that some cannabis companies are also doing advocacy work to help relieve individuals who have been wrongfully imprisoned. So broadening our, thinking about, are there public sector companies that could be, or private sector companies that could be doing advocacy work? Are there groups that are already, engaged with these communities that we could fund to do more advocacy work to get to these groups where they have the actual ability to influence the law? So those are some of my comments on equity there.
Thank you, Christina. Lauren, do you have anything to add on what we should be thinking about when we are creating new policy, either in terms of equity or other elements of data privacy?
Well, I think Christina made a great point about broadening the scope of who you think of as a stakeholder, and how tech companies generally have a larger voice in this conversation, and at the same time are the ones collecting the data, right? So they're kind of getting it on both ends. I don't think that companies anymore, let me rephrase that, anymore companies have to be very aware that their privacy management policies and principles and techniques are a competitive advantage, rather than something that is just sort of a cost of doing business, or something to just apply as a fundamental company value. It's actually something that you really can trumpet about the values that your organization cares about. And consumers increasingly care a great deal about the privacy practices of the companies that they interact with. Now, when you're in the healthcare situation, you have a lot less choice, right? When the ambulance brings you and drops you off at the ER, it's not a good moment for you to be evaluating the privacy policy and whether you're comfortable with the disclosures, like to third parties, that the hospital, might make in giving care to you. And that's where regulatory policy is so important. So people can develop trust that across the board, it would be a violation of your privacy rights for the hospital to share your information with a third party that is unknown to you and is likely to misuse your information, to use it to sell products to you, to use it for aggregation around demographics, that kind of thing. So we absolutely need policy at the higher level to protect people when they don't have the opportunity to interact with the system. But companies also can take a very front and center approach to talking about their privacy values and practices and promoting those as part of their corporate DNA. So I think there's an interlocking of public-private here that is responsive to this moment in time when customers have a louder and louder voice in advocacy for themselves, and where we see regulators, even like we saw the state of Texas putting up their wall of shame a couple months ago, which gave consumers the opportunity to actually post anytime they had a bad experience with the company's privacy policies or privacy behaviors. And we see companies from all over the country that are getting self-reported like this. So we don't want to approach it. I don't think shaming is a powerful approach ultimately. As Pam said, every time you have a data ding, it's like a black mark on your record. I don't think that's a good approach anymore. Breaches, security incidents are absolutely a fact of life. Ransomware is a fact of life. We're all going to be affected. So we need to be proactive, thoughtful, mindful, and have systems in place to deal with these incidents when they emerge, because they certainly will. I saw a article a week or two ago from the Ponemon Institute and Trend Micro, which said that 80% of CISOs, corporate CISOs, information security officers, expect a security incident in the next 12 months. So there's no point in going around shaming and pointing fingers at each other, but there's a great deal of work to be done in developing frameworks and structures that will protect people from the outset without their interaction and give them the opportunity to interact and have control over how their data is used.
We've been talking quite a bit about patient data and consumer data. Pam, can you tell us a little bit about employer data and employee data and how the new OSHA rule for privacy is going to affect us both with COVID vaccination and in other respects?
Yes, thank you. Well, of course, right now, this is the OSHA rule. Okay, so let's start at square one. The OSHA rule has been published. It was published now about 2 weeks ago. It's about 500 pages long. It is an extraordinary document. And if you're an employer, I urge you to read it now so you can start to digest the contents of it. The OSHA rule provides rules on how employers will handle public health data during the COVID crisis and any COVID data going forward, even after the crisis. And it is really extraordinary. Basically, I'm going to boil it down to its essence, which is this. If the OSHA rule survives the court challenges, which I suspect it will, although who knows. But if it does survive, basically what will happen is that employers, as they ingest public health data from their employees per the vaccination mandate, as they ingest it, employers will need to treat it as confidential health data, which is extraordinary. We really usually don't see things like this from OSHA. And secondly, the data can only be used for one purpose, which is the purpose of determining whether or not a person has had a vaccination or a COVID-19 test, if they received one of the exemptions from vaccination. So that is it in a nutshell. And if passed, if this survives the court challenge, it will provide a very, very stringent, very detailed framework for how employers will handle this data. I think it's a positive because it gives employers very clear guidelines. But again, we don't know if it will survive. If it survives, then it will go into effect very, very quickly. If it doesn't survive, we'll have to go back to the drawing board and think of something new, and employers will not have that guidance. However, the guidance in the OSHA regulation, the proposed OSHA regulation, is quite good. And I would encourage employers to look at it for ideas. And even if the OSHA regulation does not go into effect due to court challenges, it's still a very, very good regulation. I was quite impressed with it.
Great, thank you. Christina, do you have anything to add there, or about employers holding employees' HIPAA-related data?
My only comment now is that, you know, in lieu of the upcoming OSHA regulations, a lot of where you might find controls related to what you should be doing with employees' health data might be in the contracts between your insurance provider and your business. So if you're ever wondering, where can I find any information about what I'm supposed to be doing presently, that's where I would look.
Great, thank you. Lauren, you've talked a bit about companies and what they need to do with the data that they collect. Can you talk to us a bit about the privacy life cycle, you know, from design and data minimization to compliance?
I actually really like how you said privacy lifestyle first.
We want it to be.
I think we all sign up for that.
That's the dream.
So my perspective at Radar First is maybe a little bit different, certainly than Christina's and Pam's, who are more on the policy side. I am more on the execution side, and positioned both as a technology company that is providing privacy solutions for enterprise. And so we have our own development life cycle and our own set of controls and policies that we use to manage how we do our work. And also having great visibility into some of the very large enterprises in the healthcare and financial services and insurance space, into how they manage the privacy lifecycle in their business. So, and we're also kind of a startup. We're sort of a mature startup in that middle space where we've had some time to develop and learn the ropes and get better and better at what we do. And of course, as Pam said, constant improvement is the rule, rather than something that we just aspire to. It's something that we have to do every day, both in terms of keeping up with a regulatory environment that covers us, which is rather narrower as a technology company, and also keeping up with the technology environment that covers our customers, which is extremely broad across the sectors that we serve. So I think what I'd like to talk about is a privacy by design concept that applies across both the service provider, which is what we are under CCPA, or we're a processor under GDPR, and the same construct as it applies to the enterprises that we serve, who are controllers under GDPR, businesses under CCPA, kind of the same sort of construct. And under HIPAA would be covered entities possibly, and business associates, and then business associates under that, as Christina mentioned. So there's kind of a similar framework of, I wouldn't want to call it a parent-child relationship, because obviously we don't have any kind of privity of interest in that way with those companies, but as a service organization to the holder of the data. And so for all of us, we all need to do the same things at the outset, whether we're the covered entity or the business associate. And that's privacy by design, both as it's thought of as a development framework for how you manage data minimization, data segregation, controls over access to data. There's a great and ever-growing list of things that fall in the privacy by design category on the development side, the software development side. But we also can apply those privacy by design principles to the policy side. And it's kind of the thing I've been hammering on, I realized since the beginning of this conversation, is being very intentional about the data that you collect, and having both the technological controls, the administrative controls to govern that data, and also the policies that govern that data, because something will happen. That 80% of companies expecting a data breach means that something will happen. The vast majority of security incidents are self-inflicted, unfortunately. You know, it's the lost laptop, it's the company mailing that went to the wrong people, it's the packing slip that went into a box that contained medical equipment that was shipped to the wrong place. So most of the, and of course there are third parties who are actively out there trying to impact systems, particularly where they hold sensitive information. So you want privacy by design techniques and methods in your software development from the get-go. But knowing that there will be unanticipated incidents that will impact your data set, it's just as important to have policies that show that you are intentional and thoughtful and have defensible statements that you can make to regulators and to customers when they come to you and say, well, you got breached. And we're going, first of all, we're just like everybody else in the fact that we got breached. But let us show you how, as a company or as an organization or as a collector of your personal data, we are committed and continue to continuously improve our intentions around that data and our management of that data. And regulators do find that meaningful. If you never did a risk assessment for your, or a privacy impact assessment for the data that you're collecting, and then you get breached, that's gonna be a lot worse for you than if you did that impact assessment and you inadvertently suffered some kind of security incident. So privacy by design all the way in your software development stack, in your data collection practices, and in your policies across the system will go a long way.
Could I add just a word onto that? I really think that's a very, very good, solid thing that Lauren just said. So just to hone in on one point that's really important regarding the question you asked, which is you can sum it up by saying, know what data you have, know where your data is, and know what your data flows are, and know who has access. I agree, data breaches will happen. And it's not a point of if, it's kind of a when situation. So what you want to do is minimize your risk. You want to do a privacy impact assessment, and you want to keep doing risk assessments routinely. They should be a routine matter, not once every year. And a couple of things really stand out from the regulatory standpoint, which is data tagging. For large companies in particular, data tagging is essential. And I would say for small and medium enterprise, find a way to start on this. It's a long-term project, but it will pay dividends in the long run, because then you can map your data flows. Where's your data going? What regulation applies to this data? Is this financial sector data? Is this data that would be regulated under HIPAA? And so on and so forth. You can really data tag that way. And when data is tagged, you can say, was this data derived under consent or not? And you can really get quite detailed with this. So if there is a data breach, you can provide technological proof of compliance, and you can show what you did to do the right thing. And as Lauren said, if you can't do that, that's when you start entering very, very dangerous territories. It's the companies who haven't done the risk assessments, haven't mapped their data, that you'll find more stern approaches are taken. So prevention is better than the cure.
I'll just tag on to that for a second and talk about data tagging, because something I wanted to talk about, knowing that we have some enterprise scale healthcare companies on the line, is the risks of legacy data. For an ICBM space, for some of the more mature organizations that have been providing healthcare services for 20 or 50 or 125 years, I don't even know, for Providence or someone like that, you will have data, you may have data on magnetic tape stored in a vault somewhere. You have mountains of paper data possibly stored somewhere. And none of this data, and you don't know whether it was obtained under consent or what rules were in effect at the time that it was gathered and where else it might be retained. So this project of data tagging that Pam mentioned is not the sexiest exercise any of us are going to do, but will absolutely help you sleep better at night, knowing that you can respond to regulatory inquiries about personal information or healthcare information that you may be gathered in 1996 and is still live in your system. So that's one project that I wanted to mention, and I know we're just about at time. The two other things that I quickly wanted to talk about were third-party vendor risk management. We talked a little bit about covered entities and business associates. The third parties are a tremendous vector for security incidents into covered companies that hold this data. I mean, the most famous one was Target a few years ago when it was their HVAC vendor, an intrusion into their air conditioning vendor system that resulted in the breach of millions of credit card personal information and financial data about individuals. So you not look for risk in your air conditioning system, but it's there. So third-party vendor management is key. And another thing for all of us to keep our eyes on is cyber risk insurance. Have your cyber risk insurance, know your policies, have your insurer's breach response phone number on your speed dial, because that's the first place that you're going to go, and they'll be the first ones to dial down the incident severity and show you the steps that you need to take going forward so that you can have a methodical process to get through it, rather than a scattershot approach that might not be successful.
Christina, do you have anything to add on that topic of the privacy by design?
Yeah. One of the most important activities, and this is just elaborating on what both Pam and Lauren have said, but one of the most important activities is the data inventory process, data discovery. So that's what is going to need to happen in order for you to do that data mapping. And that's really the first thing that you need to do to figure out what's going on with your data. We do that with all of our clients at Gazelle Consulting, and it always reveals something that they did not expect, whether it's like they hadn't accounted for paper processes, or they hadn't accounted for verbal processes, or they only interviewed their own development team, but they didn't interview any of the marketing team. It needs to be a complete enterprise-wide inventory of everything that you have, and that's kind of the foundation for understanding your data processes.
Great, thank you. We do just have a few minutes left, and I want to encourage participants, if you have any questions, please put them in the chat. But Lauren, I want to put another question to you. We've talked about the data mapping, privacy by design. Do you have any tips for small businesses or startup businesses on how they can handle this data privacy burden?
Yeah, great question. Simple answer. Don't think of yourself as always being a small business. Plan for scale, and design your systems now so that you will not have to go back and retrofit them later for compliance. Unless you're developing an app that is like just for your friends and family, and I don't know why you would go to the trouble of developing an app for that. You're going to have health records or personal information of 500 people before you know it, and 500 people will be the trigger for notification in a lot of jurisdictions. So you need to plan for scale from the outset. And I'll keep hammering on the privacy by design concept and being mindful of the purposes that you're collecting data for. You cannot be hacked for data that you don't have. And the longer data sits in your system, the more toxic it becomes to you. So don't assume that you are always going to be a small business and you can skate under the guidelines. Assume that you're going to be a big business and that you're going to be subject to these guidelines, and be mindful about them from the get-go.
Great, thank you. It looks like we may have some questions that are starting to come in, but in the next few minutes, I want to open it back up. Pam and Christina, is there anything you'd want to add here, or any closing remarks you would like to leave the audience with?
Yeah, just very, very briefly. I really like the idea of planning for scale. An app that's developed in a bedroom could have global reach very, very easily after it's been accepted on the App Store. And then all of a sudden, you may not realize it, when you've been in create mode and, build mode, you may not realize that all of a sudden when you do that, you have stepped your foot into a very big lake of regulation, both at the state level and at the global level. So it's really important to get counsel, get professional guidance on these issues before launching any kind of new technology or service, because there is really a lot to think about and do before that step is taken. And even if you're a very small business, because today all of us have a bit of a borderless situation, and that has accelerated greatly during the pandemic, I think it's right to plan for scale and to really make yourself aware of the extraordinary regulatory landscape in regards to data. Thank you.
Thanks, Christina.
Yeah, and I just like to underscore the value of the risk assessment for every business that handles healthcare data. For small businesses in particular, or companies that are entering the healthcare industry for the first time, the risk assessment, HHS risk assessment, is going to be a standard body of evidence that you'll need to supply anybody who's going to be starting a contract with you as a business associate. Additionally, doing the risk assessment allows you to do risk-based decision making when there's limitations to what you can do. So you come up with this whole book of risks, but you're not going to be able to necessarily remediate them all. So the risk assessment will allow you to plan for the things that you can't do now, whether that's things you're going to do 1, 2, or 3 years in the future, or things that you'll accept your risks on, because maybe there isn't an alternative software provider for you to use, or maybe you have, cost resources or infrastructure or risk-based resource limitations. So that's really the roadmap that you'll need, is a risk assessment to win new work and figure out your path to move forward through the work that you have to do ongoing in compliance.
Yes, definitely. +1 on that for sure.
And minimize risk as well, I'm sure.
And minimize risk, yes.
We do have a question here, and I think Pam or Christina, what is the best approach to become owners of our own personal health information?
It's an interesting question. I think I'm curious to hear, Pam, what do you think that we are owners of our PHI? But to talk about how you can get access to it, I try to go to all of the organizations that have my data and request a copy of it. We don't have those rights in Oregon, but we get to access those rights because of the CCPA in California and the GDPR in Europe. So when you can get a copy of that data, whether it's health data that an app has, or if it's a hospital, you have those rights under HIPAA to request a copy of your data. But start figuring out what they have and learning about what people know about you.
Yeah, it's a really challenging question, and let me describe to you why in the area of health data. Health data is considered to be, especially public health data, it's considered to be a public good. So there are exceptions, exclusions, derogations in every law, I think in pretty much every jurisdiction, that allows for really nearly unlimited use of health data for research purposes. There are constraints. There are a variety of rules and whatnot around this, but we really need to think of our health data, and particularly our public health data, but also our HIPAA covered health data. We need to understand that it's very important for us to access it. We can also amend that data under one of the 7 rights of HIPAA that patients are granted. But we don't own our data outright. And I'll tell you, when I really discovered this in the most profound way was way back when we published our report on medical identity theft. We do not have the legal right to delete our health data because of a variety of legal and HIPAA rules. So I don't think we own our data. However, we do have a share in it, just as the public health providers do, and just as the covered entities under HIPAA do. So in short, access your data. If you want to amend your health record, you can do that. Exercise all of your HIPAA rights. But in terms of owning our data, we don't yet have that, not right now. And I think it would be very difficult. In Europe, you don't own it. In the United States, you don't own it. I can't think of a jurisdiction where you own it. If you know of one, please let me know. But in general, this is a very, very difficult subject in the healthcare sector.
And I'll just point out that if you owned your data outright, other people couldn't monetize it. They'd have to rent it from you or license it from you in order to be able to monetize it. But companies like 23andMe that are using your healthcare information, specifically information about your DNA, to develop products, healthcare products, pharmaceuticals in particular, that they will then market back to you to treat the maladies that they discovered by seeing your DNA in the first place, means that while you're a stakeholder, you're not going to be an economic beneficiary of ownership of your data. So I think Pam's point about you having a share in the ownership of your PHI is important, and you should exercise your rights with respect to that share. But understand that there are a lot of forces at work that see a tremendous opportunity for wealth from exercising their share of your personal information. Makes it all the more important that you pursue your own rights and abilities.
Well, that's a great way to end this this panel. Thank you to my three panelists and to Skip for inviting us all here today. Thank you, everyone, and enjoy the rest of the conference. And Skip, I'm going to turn it back over to you.
Great, thank you, Anne. Appreciate your expert facilitation of this important topic, and of course the panelists spending some time early with us on a Monday morning. And also, again, thank you to all of the attendees. I know it's there's a lot that people can be doing with their time these days, including not spending it on Zoom, and you've chosen to spend it here. So we appreciate that. As Riley mentioned earlier, we have some more programming coming up today around 10:30 on mental health issues in tech. And we've got some more programs coming up tomorrow as well. So invite you to check those out as well. Hope you all have a good start to your week, and we'll see you soon. Thanks.
Thank you so much.
Thank you, everyone.
Thank you.